thank you once again, Joe, for having us here and for those words of introduction and welcome. So at this point, it's really a pleasure for me to introduce our keynote speaker, Dan Buettner. He's a well-known founder of the concept of blue zones. He's a National Geographic Fellow and a best-selling New York Times author for the blue zones concept. He'll talk about it. A more complete bio sketch is available in the materials, but I thought for particularly the purpose of this workshop, it would be important to highlight the fact that Mr. Buettner and his partners, AARP, have applied the principles of the blue zone concept to Albert Lea, Minnesota, and successfully raised life expectancy and lowered healthcare costs by some 40%. He's currently working with Healthways to implement the program in 3 beach cities: Los Angeles, Fort Worth, Texas, and Kauai, Hawaii, and the entire state of Iowa. I've had the opportunity to visit with Dan on the bus on the way over. He asks really good questions, as well as has a lot of good information. I've had the pleasure of hearing him present in Minnesota to Health Partners several years ago, and I know that you'll be interested in hearing what he has to say. It's very important. So please welcome Dan Buettner.
Oh my God, what a thrill. The National Academies of Science Institute of Medicine. Well, I'll establish my credentials by telling you that I have a bachelor's degree in business administration. I knew that would impress you and capture your attention for the next 30 minutes. I began my career in population health by riding my bicycle from Prudhoe Bay, Alaska to Tierra del Fuego, Argentina, when you were striking off to do useful and productive things with your life. 15,536 miles. I know it sounds impressive, but anybody who's familiar with world geography knows it was all downhill. So we're going to have some fun here, but I'm going to talk about serious things. So something called the Danish Twin Study established that only about 20% of how long the average person lives is dictated by genes, 80% is lifestyle and environment. In about 2002, I teamed up with National Geographic and got funding from the National Institute on Aging to, in a sense, reverse engineer longevity. And our approach, rather than sort of go micro, was to go really macro. We hired a team of demographers to sift through census data, birth records and death records, and the statisticians who could adjust for immigration and emigration. And we found these 5 pockets where people are living verifiably longer by a number of measurements. So these are places where people have achieved the health outcomes that we want: much lower rates of chronic disease, higher life expectancy, much lower rate of middle-age mortality, and then put together a team of experts who could help us using established methodologies to distill down what they do. Some of this was correlation work, statistics, some of it was investigative reporting, some of it was anthropology. But remarkably, no matter where we went, we found essentially the same 9 characteristics, no matter if we were Asia, or Europe, or Latin America, or even the United States. And my real goal with this was to try to distill out the lessons that could teach us as individuals, and now most recently teach those of us who are involved with making populations healthier, whether it's workplace or community. What lessons were portable? What wisdom that evolved over centuries, in some cases millennia, survived at sort of societal evolution, could we apply in 2014? Before I talk about that, I'm just going to very quickly, I have 30 minutes here, but I want to take you to a few of these blue zones to just give you a taste. The first one we found in the year 2000 off the coast of Italy on the island of Sardinia, cluster of 42,000 people, 14 villages. And interesting, right here, this blue bullseye, you have the highest concentration of male centenarians in the world. About 12 times more male centenarians, proportionally speaking, than it's off the charts. This is a culture mostly shepherds, which you'll find out in a little while. helps give an idea of how much physical activity we should be doing. They eat mostly a plant-based diet, some pork, but more interestingly are their attitudes towards aging. Instead of social equity peaking at about age 30, there the older you get, the more celebrated you are. On the other side of the planet, 800 miles south of Tokyo on the archipelago of Okinawa, you find the world's longest lived women. In some areas, about 30 times more female centenarians than we have in the United States here. Overall, the longest disability-free life expectancy in the world. And yes, they eat a plant-based diet, but they have nothing special going on with their genes. They do have some cultural institutions that we think map to longevity. Social networks. People aren't lonely there because at age 5, they're put into committed social networks. They travel through life together. These 5 girls are 102. They've been friends for 97 years. Still not afraid to tell each other what's up. Also, and this is really interesting, and this is the type of thing we don't think about when we think about Okinawans have no word for retirement. Think about that. There is no artificial punctuation that puts an end to your productive life and begins your life of repose or going down to Arizona. Instead, one word, ikigai, imbues their entire adult life from the time they're in their 20s all the way into their hundreds. In America, we found the blue zone, quote unquote, among a subculture here, the Seventh-day Adventists, conservative Methodists, who distinguish themselves from other Christians in that they evangelize with health. They run big hospitals. But they also celebrate their Sabbath on Saturday instead of Sunday. And this is a really interesting group. And those of you who are into epidemiology, there's the Adventist Health Study 1 and 2, some of the most interesting data, I think, in America here. Life expectancy for women in this country right now is about 80, but for adherent Adventists, it's 89. And for men, it's even more remarkable. And what makes this remarkable is the highest concentration of Adventists live off the San Bernardino Freeway under a cloud of smog right outside of Los Angeles. And, they live next to the Taco Bell and the Wiener Hut, but somehow they've been able to create what we want, which living a much longer life and with much less chronic disease, especially certain types of cancer and heart disease. They take their diet directly from the Bible. This is interesting. I'm not a big Bible reader, but if you go to Genesis chapter 1, verses 26 through 28, God lays out the diet of the Garden of Eden pretty clearly. It's pulses, seeds, and then one stanza later, she talks about green plants. This is a culture that yielded Ellsworth Wareham, 97 years old, multimillionaire, yet when a contractor wants $6,000 to build a privacy fence, he's like, well, for that kind of money, I'll do it myself. And for 3 days, he labors under the sun, hauling cement, and on the 4th day, predictably perhaps, he ends up in the hospital. But not as that open heart patient. Ellsworth is the guy to the left doing open heart surgery. 20 open heart surgeries every month through age 97. Ed Rawlings, 106-year-old cowboy, starts his day with the swim, and then on the weekends likes to put on the boards. And then my favorite, Marge Jaton, 105 years old, wakes up every morning, reads her Bible for a half hour, eats her oatmeal, she's very prescriptive about this, eats her oatmeal with soy milk and nuts, followed by what she calls a prune juice shooter. So ponder that for a minute and then move it right out. And then she goes down and she pumps iron and gets on her bicycle, 105, and then gets in her 1994 Whoop Your Car Cadillac Seville and barrels down the San Bernardino Freeway, where she still volunteers for 6 organizations. Now, the reason I'm showing you these pictures, and you guys were reacting nicely, is health information is boring. People's eyes will glaze over it. If you unleash a tsunami of the best research, people's eyes, people like stories. 60 Minutes, Don Hewitt, the producer of SIP for 35 years, he was asked, what was the secret to making 60 Minutes successful? 4 words: tell me a story. So the extent to which you can fold in health information and put it into a story Show people other people who they might aspire to. The more engagement you'll get with it. We found our fourth blue zone with the help of the Bill and Melinda Gates Foundation, the Coya Peninsula of Costa Rica. This place has the lowest rate of middle-age mortality in the world. They spend 1/15 the amount we do on healthcare. So a 50-year-old guy has about a 2.5 times better chance of reaching a healthy age 90 than we do in America. So it starts to add credence to this notion you don't necessarily need to be rich or have the best healthcare treatment to be healthy. I know that probably sounds like a heresy here at the Institute of Medicine, but and then the last blue zone we found off the coast of Turkey, actually the Greek island of Ikaria. This was right in the middle of where Western civilization got its start, but this was largely overlooked in the 1970s. This is a place where it has the greatest adherence to the Mediterranean diet. They live about 7 years longer than we do, but most interestingly, and we recruited the University of Athens to do a survey of all 674 people over age 70 on the island. And we found that they use the same cognitive tests that the National Institutes on Aging uses. They have 1/5 the rate of dementia that we do in the United States. So not only are they healthy, but they're also staying sharp to the very end. It said there's been a couple papers published on this. So at 80 years old, about 80% of them are still engaged, growing their own food, doing their jobs. They have what we want, which is to live a long time and really enjoy the last years the most. I'd like to tell the story of this fellow here on the right, Stamaitis Moriaitis. Comes to America to seek his fortune, gets a job as a painter, makes enough money to buy a house, marries a Greek-American woman, and buys a Chevrolet, the American dream. But at age 66, he finds himself short of breath. Goes to 3 doctors, all of whom say terminal cancer. You've got 6 months to live. Instead of dying in the United States, so he figures, I'll go back to Ikaria, get buried with my ancestors, and spend 1/5 as much on my funeral. Money left over from my wife. Well, he goes back, he starts drinking the wine, eating this Mediterranean diet, connecting with his friends. They come over every afternoon with a bottle of wine. He reconnects with his religion. He marches up the hill every Sunday where his uncle is a pastor. He's feeling pretty good, actually, after 6 months. He grows a garden, doesn't figure he'll be around to harvest that garden, but he thinks, my wife will have some vegetables, she'll remember me. Well, I met him 37 years later when he's not only growing a garden, he's growing a vineyard that produces 200 liters of wine, all of which he drinks. 102 years old. And I asked him, and this is very emblematic, how did you beat lung cancer and make it to 102 years old? And he just shrugged. He said, well, I guess I forgot to die. And the reality is 100-year-olds no more know how they got to be 100 than a tall man knows how he or she got to be tall. You have to see what the population has done in order to explain it. And this is now about 4 or 5 years into this Blue Zone research. I've been at it for about 10 years. And I had an epiphany, a really important epiphany. So when I started off on this, and I'll admit to you, I was kind of hoping I'd find some compound, some supplement that I could put in a pill and come back and give America the secret to anti-aging. It doesn't exist. There might be some genetic intervention down the road, but it's not here. And it's not necessarily what we want. I realized in meeting all these centenarians, and especially Stamaitis here, that in no case did at age 50 did they say to themselves, well, go darn it, I'm going to get on that longevity diet and live another 50 years. Never did they put a treadmill in their basement and say, I'm going to start getting in shape now. Or they didn't call an 800 number and buy a supplement. The big idea here was that longevity happened to them. It ensued from the right environment. It was not pursued in no case. So when looking at the environments of these 5 blue zones, you see the same 9 things happening over and over again. They really don't exercise. And as you guys know, in America, exercise, by and large, has been a public health failure. The average American burns about 100 calories a day engaged in exercise. It's a good idea for a small sliver of people, but most Americans aren't doing it enough to make up for what they eat. In blue zones, our team figures that people were nudged into movement every 20 minutes. They were gardening. Their houses were not full of conveniences. They needed their own bread. They used hand-operated tools. When they did go place, it was almost always on foot. They walked to school. They walked to their friend's house. They walked to go out to eat. They walked to their workplaces. Their idea of socializing was walking. It wasn't a chore. It wasn't something you put in your Outlook and something you have to do. It was engineered into their daily lives. They suffer the same stresses that we do. Stress is part of the human condition. There's no island you can retire to where stress goes away. But what they did have were daily rituals that reversed that inflammation of the hurry and worry of our lives. Prayer, ancestor veneration, you've seen in Okinawa. In Okinawa and in Costa Rica and Icari, they took naps, which, by the way, is associated with, we might be doing some of that later here, by the way. But a daily nap taking is actually associated with lower rates of heart disease, as much as 30% lower rates of heart disease. And the Sardinians, they just did happy hour, which is a good way to turn around stress. They had vocabulary for purpose. A study came out just 2 weeks ago from Canada, followed 6,000 people for 14 years, and found that those people could articulate their sense of purpose, had 15% lower risk of dying. National Institutes on Aging did another study several years, found that people who could articulate their sense of purpose were living up to 7 years longer. Very important. In blue zones, people actually had vocabulary for purpose. Words like ikigai and plan de vida, and no word for retirement. When it comes to what they ate, well, they all consume little alcohol, except for the Adventist. And as you've heard, we've seen as much as 4 glasses a day, but it's really 2 glasses a day, pretty much the common wisdom. But no, you can't save up all week long and have 14 on the weekend. I just finished doing a meta-analysis of 154 dietary surveys in all 5 blue zones, and I have a really good idea what 100-year-olds really ate to be 100. Mostly plant-based diet. 95% plant-based. They eat a lot more carbs than we think, but it's in the form of, as you might predict, whole grains. Sourdough breads as opposed to breads leavened with yeast makes a big difference. Beans. I would say if the longest of people offer us one lesson about making America healthier, how we eat, they know how to make beans taste good. If I had found that broccoli is the secret to longevity, it'd be a complete failure. You wouldn't eat it. But they know how to make these wonderful bean stews. And we all know beans are cheap. They're full of fiber. They're full of protein. They're nutritionally rich. Anybody can afford them. They know how to make them taste good. And then they have little strategies to keep us from overeating. You know, the food industry spends $9 billion a year to convince us to eat more food, most of which isn't all that good for us. In blue zones, they have strategies to take food out of their daily diet. Things like stopping to say prayer before meals. Actually slow down so it's a better chance that that full feeling can travel to your brain in time for your food to be done. They don't have TVs in their kitchens. They eat with their family. There's evidence behind all these, by the way, to show that it's worked in clinical settings or worked in studies. In all 5 blue zones, and this is interesting, same pattern. They eat a huge breakfast like a king, lunch like a prince, dinner like a pauper. In Okinawa, they actually don't even eat dinner, but it's the same trend no matter where you go. And then the foundation on which all of this stands is how they connect, investing in their families, keeping their aging parents nearby. We increasingly warehouse our aging parents, but they're incredible fonts of wisdom that actually favor the survivability of children. They invest in their spouses. It's worth 2 to 4 extra years of life expectancy. They invest in their kids. They tend to belong to a faith-based community. Best public health intervention there is get people involved with faith. Doesn't matter if it's Jewish, Christian, Muslim, Buddhist, doesn't matter. But we know that engaged, faith-based individuals live 4 to 14 years longer than their church-going counterparts. And then the other notion is to think about who we hang out with. One of my colleagues on this Blue Zone Ventures, Harvard physician by the name of Nicholas Christakis, he essentially found that health behaviors are contagious. Your 3 best friends are obese, it's about 150% better chance that you'll be overweight. Your friends drink or smoke, that's contagious. Even loneliness and unhappiness is contagious. So thinking about how you curate a little group of people around you can make a huge difference. Because when it comes to longevity, there's no short-term fix. You have to think about things that are going to last decades or a lifetime if you really want them to impact life expectancy, which of course is a proxy for lower rates of chronic disease. So you guys are probably looking at this saying, yeah, this makes a lot of sense. But how do you get populations to adopt it? Well, in America, we spend a lot of money on health promotion. We spend a lot of money on diets, exercise programs, and supplements. And actually, they're not bad ideas. Good idea to educate people on the right thing to eat. Good idea to get people moving. Some people need supplements. I would argue a very small minority, but nevertheless, some people do these things. The problem is we spend a lot of money on it, and in every case, they're short-term successes and long-term failures. Get 100 people on a diet today, within 3 months, you're going to lose about 10% of them. Within 7 months, you're going to lose about 90% of them. And within 2 years, you lose almost all of them. I defy anybody to tell me about a diet that works for more than 5% of the people after 2 years. It's just a bad way to spend money. Exercise programs, they have a similar recidivism. People tend to start them after the holidays with lots of enthusiasm and run out of gas by September. And even if I come back from Blue Zones with the supplement that assured anti-aging, Americans wouldn't take them long enough to make a difference. So if these strategies don't work, what does? 6 years ago, I went back to National Geographic and applied for another grant. God bless their yellow rectangular hearts. Resubscribe to your magazine. And the proposal this time was, rather than Blue Zones, I wanted to look for populations that were unhealthy and got healthy. So in other words, instead of an infectious disease public health initiative, a non-infectious disease public health initiative. And I spent a lot of time. I looked at CDC, they were very helpful, World Health Organization. I found that, at least at the time, in America, there's never been a very successful public health initiative for non-infectious diseases, citywide. There were huge ones. There's actually a big one in Minnesota, the Heart Healthy Program funded by the NIA. We spent tens of millions of dollars. Another one in Stanford. In every case in the United States, we saw more or less the health equivalent of the Hawthorne effect. When the scientists were there paying attention, TV cameras were rolling, people were doing the fun runs and eating their veggies, but as soon as the scientists packed up and went home, people reverted right back to their baseline behaviors. Plenty of evidence on this. There's one place in the world, we found it in Finland, far eastern Finland, North Karelia, population of 140,000 people. Pekka Puska ran it when he was a young man. He went on to the World Health Organization. But in 1972, they had the highest rate of cardiovascular disease in the world. Rich white guys dropping dead at 50. Pekka and his team reversed that, brought down cardiovascular disease in over 30 years, brought it down 80%, brought cancer down over 60%. And you say, these people have something. So I went and bet with Pekka Puska, and they spend some money on promotion, but as the project wore on, they shifted from the individual. We talk a lot about individual responsibility here. Well, most of Pekka's intervention basically ignored the individual and focused on the environment, the system around the individual. I call it the life radius. And you can't do the same thing in Albert Lea, Minnesota that you do in Finland. It's a different culture, different health issues. But he did provide me a very valuable, and to put it in kind of computer language, an operating system. It's not a program, but an operating. This is a way of looking at the problem. And it's very much in line with that old Stamitis Moriitis, that instead of looking at the individual and intervening at the individual level, you change You make sure longevity happens to people. So we came up with this concept of life radius. I got about $1 million from AARP, and I spent most of it on hiring smart people who knew how to optimize the environments we live in. Brian Wansing from Cornell Food Lab, Nicholas Christakis, Leslie Lytle from the University of Minnesota, Daniel Burden, who's an expert in built environment. And we came together and we came up with a blueprint. And essentially, we look at the areas that will most positively impact people's life radius, where they spend about 80% of their life. Number one, best investment. I think the CDC will agree with me. Policy. You live in a place where fruits and vegetables are cheapest and most accessible, or a place where French fries, chips, and sodas are cheapest and most accessible. Are your ordinances such that that communities sprawl out, or are there incentives to turn inward and create a livable core? Is smoking easy to do as it is in West Virginia, where you have smoking rates as high as 35%, or is it hard to do, such as in San Luis Obispo, where smoking rates are under 10%? Built environment. By just making the active option the easy option, you can raise the activity level of an entire population by 30%. No gym memberships, no yoga classes, no ab master. You just make it easy to get to school, get to work, get to the grocery store, make it safe. Social networks. I think we probably do more on social networks than most other programs do, but finding the people who are ready to change their habits and then strategically putting them together to set up that network and then introduce the right contagion. Building designs, huge opportunity. Schools, restaurants, grocery stores, workplaces. We found over 120 little tweaks, little defaults that you can set up in buildings to nudge people to move more, eat less, eat better, socialize more, smoke less, and reduce stress. They're all evidence-based. You just unleash that healthy swarm. And then finally, and this is, again, unique to our program, we're big believers in purpose. Taking a pharmaceutical approach, again, people don't feel right about it, but we go in and the critical mass of people in our communities, we give a purpose workshop to, and then we connect them very quickly to volunteering. And as many of you know, volunteers have lower rates of cardiovascular disease, lower healthcare costs. But we sort of set up this model, and then when we go and execute, we have teams. We're now in 20 cities, but we have teams that execute on 12 pillars. So we start with city government, built environment, food policy, and tobacco policy. And we think we have the best practices. But we learned in a hurry, you can't go in pontificate. People will show you the door right away, especially small towns, conservative. But we learned how to have a conversation, get their ideas, gradually introduce best practices, get them to decide on 10 priorities, and then coach them and help them manage a timeline to fruition. This is working. This is the best investment right here. Biggest impact to the population. But we also work on optimizing the buildings that people spend their day in. And we've come up with checklists for each of these 6 environments. And we kind of dangle the notion of Blue Zone certification in restaurants, and grocery stores, and so forth, if they get enough, if they achieve enough of these checklists. Revenue neutral. Can't ask people to spend money. But there's a ton of revenue neutral changes. And then we do have a few programs. We recreate, remember those old ladies? We recreated Moais, and they actually go very well. We help people create new social networks that tend to last, get them involved in volunteering right away, and then give them a purpose test. These 3 things, you start talking to public health, they're like, what? But really, we've gone through 6 iterations now, and these programs are really worth investing on the population scale. We started with Albert Lea, Minnesota. And we actually auditioned 5 cities. The wrong way to do these population interventions is to show up and say, guess what? I got the answer for you. We go up, we just open our kimono and say, if this is for you, here's what you have to do. And then all of a sudden, we make every mayor, city manager, the head of public health, the superintendent of schools, they have to pledge. You don't want to go to some place to think you're nanny state and waste 3 years bickering in city council meetings. You make sure they're ready to go, and then we start. So Albert Lea was ready. All the leaders were signed on. We could see they worked well together. They gave us 120 volunteers in office. Then we came in and we listened. Not pontificate, we listened, found out where the feet were going in the same direction, got them going with us, set up measurements, very important. Dan Burden, he's Amadeus Mozart meets Albert Einstein of city planning. He looked at Albert Lea and he said, beautiful city, but you can't walk anywhere. And he knows that there was a budget, but he noticed that it was Albert Lea was essentially set up in quadrants, and he set up one vector so that everybody could at least walk downtown. This occasioned only connecting 2.5 miles of sidewalks so that older people didn't have to walk through fields or cut across really dangerous traffic. So now everybody could go downtown for dinner, to church, or to schools. Albert Lea wanted to widen its main street, raise the speed limit, which of course creates stress, dangerous, noise pollution, air pollution. He said, wait a minute, let's just put this idea on a shelf. Let's take some of that street. You couldn't tell them that. It was a long conversation. And convince them to, instead of that project, we took a little bit of money. And you see right here in Albert Lea, there's this little lake. It's right at the end of Main Street. Beautiful lake, but there was no way to get around it. We convinced them to let us put a trail around it. Build a trail around it. That trail is packed all the time. We don't have to give these people a discount on their insurance. We don't have to give them a free t-shirt. You just make it easy and accessible and pretty, and that's generated hundreds of thousands of hours of physical activity. Parks and Recs were just mowing vast acreages of lawns. We convinced them to let us put in 6 community gardens. We kind of bit our fingernails for a while when we first put them in. They filled up instantly. They put a 7th one in the second year. So it's not only a good place for regular low-intensity physical activity, but people connect. It's really important. Brian Wansik helped us create a grocery store and a restaurant pledge. Had them doing simple things. When you go to a Blue Zone restaurant, instead of automatically getting bread, the default is you have to ask for bread. Do we really need the bread and butter before dinner? Instead of automatically getting fries with your sandwich, you automatically got fruit, but you could ask for fries. We change adjectives on menus. Huge opportunity with changing adjectives. Making sure people know they can have split plates. Making sure they know they can take a doggy bag home. Do you know the adjective that most assures people aren't going to order an entree? The healthy choice. Nobody wants the damn healthy choice. When people go out, they want to eat something good. So you take that healthy salad and you change the name to the Italian Primavera salad, and it's the same damn thing, but sales go up by 15%. We don't touch the price at all. We just change the adjective. So there's dozens of little things that when you get them all working in the right direction. The big Hy-Vee chain agreed to tag Longevity Foods. We created a Blue Zone checkout aisle, so they're all healthy defaults when you're hungry after shopping and checking out your... we went into schools, and without even touching the 900-pound gorilla of school lunches, there's a couple other things that make a huge difference in schools. Making sure there's a policy that there's no eating in hallways and classrooms. That little thing alone, BMI of the average school that has that policy is about 9% lower than the school where kids can eat all day long. Because if they're eating all day long in classrooms and hallways, what are they eating? Not celery sticks. Then we invited people to join. And we kind of set it up as an elite club to become a Blue Zone certified member. And we introduced the idea. We said, you don't have to be this. There's nothing in it for you, no money, except you get to be part of the Blue Zone Club. And we got about 25% of the population to sign a pledge. We have a tool we developed with the University of Minnesota called the Vitality Compass. It lets people calculate how long they're going to live, but secretly we capture 33 metrics of what they eat, how much they go to church, their BMI, etc. So we can get a baseline. And then if you haven't taken it a second time, we get a pretty good measurement. There's a few other measurements we're using now, mostly with Gallup. They had to agree to let us come into their houses and optimize their kitchen, smaller plates, digging gardens out back. We got them 1,100 people to join a Moai, 60% of which are still together 5 years later. And then we gave everybody a purpose class and very quickly introduced them, speed dated them with volunteer organizations. Quickly, when people are infused with this new purpose, give them an outlet for it. Worked fantastically well. So after the first year, at about 24% of the adult population, most of the employees signed on. The Vitality Compass, the representative sample we took, we saw a 3.2-year bump in life expectancy. Collectively, though this wasn't a health, it's fun to count. It's not all that significant scientifically, but people self-report it, dropping over 2 tons. But then city workers, the city of Albert Lea, reported this independently, a 40% drop in healthcare costs. And that's really the thing that captured national attention. Good Morning America a few times, USA Today. Walter Willett wrote a really nice piece in Newsweek magazine after visiting the site. But everything the operating systems was what were the permanent or semi-permanent way we could change the environment, change the ecosystem. From Albert Lea, we teamed up with Healthways. We did a nationwide RFP. 55 cities applied, and we ended up picking the beach cities of, Mama didn't raise no fool, of Los Angeles. And the same operating system, after 3 years, we brought in Gallup to do the measurement, the WBI. I think it's the best population-wide health measurement, that's cost-effective, but they measure 80 different facets of well-being, both health and psychological. But interestingly, after 3 years, we saw a 14% drop in obesity. And you do not see that in California. In California, there's about a 3% drop in obesity, and there's no other city with that great a drop in obesity. 30% drop in smoking. People reported better eating habits and more physical activity. That caught Blue Cross Blue Shields of Iowa's attention. The governor of Iowa, the Republican governor of Iowa, I might add, Terry Branstad. We were invited in for a publicly supported, privately funded effort to blue zone the pork state. And I'm like, holy crap. What am I going to do? These are largely overweight Midwesterners. How do you do a whole state? And, you get your best ideas not by reading more health literature, but going outside of health literature. And I read this story about a guy named Seaman Knapp. How many of you have heard of Seaman Knapp? Anybody? Seaman Knapp was an agricultural explorer, for lack of a better description. Back in the early 20th century, he traveled to Europe and to Asia to find new seed strains and new ways of tilling the soil and new fertilizer. And he brought it back to America around 1905. And back then, in 1905, the agricultural system in this country was a mess. We spent 50 cents out of every dollar we earned for food. It was rife with old world thinking. Farmers were reactionary. They didn't like book farmers. And Seaman Knapp comes with all these great ideas that he knows worked, and nobody listened to him. He's the University of Iowa adjunct professor. Finally, he got one farm in Terrell, Texas, to agree to let him come in with these interventions. He had a grab bag of interventions for farm. And 1905 happened to be the worst year in American history for cotton farming. Every other farm around the farm that he worked with lost money. His farm made money. And all of a sudden, the other farmers paid attention. Long story short, the precursor of the USDA hired Seaman Knapp to set up demonstration farms. So again, it's one thing to tell a person, but when you show a person and show success, that's when you start getting traction. So we had the same idea in Iowa. Instead of saying we're going to try to do the whole state, 3.2 million people, 995 cities, forget it. We set up demonstration cities. But we didn't, once again, just say, guess what? You win. We did a road show through all of Iowa. It took us 2 weeks on a bus, barnstorming, and we auditioned 93 cities, and then we just picked the top 10 cities that were most ready, and already half our work was done. And we started working with 10 of them now. and already we're showing impressive drops in obesity rates, healthcare cost savings. Wellmark, the Blue Cross Blue Shield of Iowa, their actuaries are calculating a healthcare savings over a 10-year period of being about $5 billion based on blue zones. Their calculations, not mine. Counterintuitively, that caught the attention of Texas Health System, another one of these closed systems, more or less closed. We started a project now in the reddest city of the reddest state in America. They're big on beef, but their mayor there, city manager, everything, they've embraced it. We were just starting there. And then earlier this year, we started, again, Mama didn't raise no fool, in Kauai, Hawaii, and now doing a statewide initiative. But the way they wanted us to set up, instead of focusing on City Hall, we're starting with the biggest employers. Because in a way, when you think about it, your employees spend 2/3 of their life outside of your building. So you can come up with the best cafeteria and the best yoga class or whatever, but 2/3, when they go out, they're going to go sit on a bar stool and drink whiskey all night. So we conscript the big employers to help us blue zone the area that their employees live in, to get the restaurants on board, their kids' schools, grocery stores, etc. And it's working very well. We're working with 3 big employers down there, including HMSA, the Blue Cross and Blue Shield. So I'm going to kind of close here with telling you some of the lessons I've learned. 20 cities now, 6 iterations. And to scale it, that's the hard part. You can have the greatest idea. As Mark Twain said, 1% inspiration, 99% perspiration. I'll tell you, we stumbled over the time. But unlike, public health, typically the wisdom has been you target the intervention at the most at-risk population. So for vaccinations, it's kids. For heart disease, we screen for a high blood pressure and we intervene there. I will submit to you with my business degree and bachelor's degree in business administration that for prevention, you want to target the people who are most ready. You want to identify those first and spend your money there, whether it's an employer or whether it's a community. It takes some time to find readiness, and you have to be willing to say no. We've said no to over 100 communities. Number 2, invest in rigorous measurement. You can't measure, you can't manage it. And also, you can pound your drum all day long, but unless you have some data to back it up, people who count like you guys will just say, yeah, right. You want to orchestrate the perfect storm. If you go in with a little dribble, it almost always fizzles out. I don't know of any time it doesn't fizzle out. But in our cities, we make sure it's in schools, restaurants, grocery stores, city council. We make sure the media is involved. You cannot turn around without hearing blues. You can't avoid it. Then that starts to set up that epidemic that you can start to seize. And none of them, by the way, none of the interventions, there's no downside to any of them. They're all upside, maybe a little cost in some of them. It's just nudges, really. Again, think about your programs not as a program, but as an operating system. How can I make permanent or semi-permanent changes to the system? And then finally, you need to have a pretty long time horizon. Maybe not so much for the workplace. You can do a pretty effective intervention in a year. But for communities, it really needs to be 3 or 5 years because policy doesn't happen quickly. And changes in the streets, and we figured do a lot in Elbert Lee in a year, and they're still making the changes 6 years later. So 3 to 5 year time horizon. In Iowa, in fact, they're bringing us in for another 5 years. So we really have a 10-year time horizon for a state. So it doesn't happen fast, but it can happen. So I'm going to close with my buddy Samitis Moriaitis. Remember the Greek guy who went back, forgot to die in Italy? I actually called him on Skype a few months ago. I was in the morning, it was at Starbucks in Minneapolis. He picks up his phone in Ikaria, still lives in the home of his parents, and it's mid-afternoon. He picks up, he's sounding lethargic, he's took a nap. And I was writing about him and applying him with a bunch of questions. And he said, you got to hurry this up. I got friends coming over. And I said, okay, one last question. Did you ever figure out how you dodged lung cancer? I mean, almost nobody does. How did you do it? And he said, yeah, I did a lot of thinking about that. He said, in fact, About 15 years ago, I went back to the United States to get some tests. I said, yeah, what'd you find out? He said, nothing. And I said, what do you mean? He said, I got back to the States and all my doctors were dead. Thank you very much.